Discuss another medical emergency, and this is what is known as heart failure. So, what is heart failure? So, we're trying to discuss for this lecture. All right. So, this is your heart, and heart failure for me, I could just simply say it's when your heart is not able to perform its basic functions, which is pumping blood around the body, receiving, you know, deoxygenated, moving it to the lungs to be oxygenated, putting it back into the heart, moving it to the body for distribution. So heart failure, you should know that it's a condition where the heart cannot perform its basic function, which is what? Pump blood effectively to meet the body's needs. So it has a lot of symptoms associated with it. So what happens in heart failure? Um, the heart muscles, they actually become so weak, okay? Or we say they become too stiff, you know, to function. So as a result, blood is kind of like what? Packing up in the lungs. Because from the lungs, the heart is supposed to receive the blood. If the heart is not receiving well, you have congestion. Now, this leads to a respiratory issue because you breathe in your lungs. So can you see that the heart is connected to so many systems, every system. So packed up in the lungs and all of that. So the other organs that the heart was supposed to collect oxygenated blood and send to them, they are not receiving. There's like a break in the supply chain. So what are the issues that a patient having heart failure will mostly feel? So shortness of breath, swelling in the legs, ankle, swelling the abdomen, persistent coughing or wheezing. The person is fatigued, weak, rapid or irregular heartbeat, sudden weight gain, because what? So much of the fluid is being kept back in the body because it's not following the right chain again. Common causes could be high blood pressure, coronary artery disease or heart attack, heart valve disease. You have cardiomyopathy caused by so many things. You are taking alcohol, you have a viral infection, you are born with it. Also, diabetes and thyroid disorders can also go to cause um, heart failure. Okay, so you manage heart failure using several drugs. It's mostly a medical issue, except you want to do surgeries for some things to correct congenital anomalies or do a transplant, which is rarely done, or probably different surgeries can be done on the heart though, but mostly they use drugs to handle it. So angiotensin converting enzyme inhibitors, angiotensin receptor blockers, beta blockers, diuretics, aldosterone antagonists, SGLT2 inhibitors. The lifestyle changes like you reduce the amount of salt you are taking, stay physically active, avoid smoking and taking alcohol, monitor your weight daily. Okay. They can also give you pacemakers, defibrillators, you know, heart valve surgeries or heart transplants in severe cases.